So the first question is, can you describe yourself in a hashtag?
Uh, Calm, composed, compassionate doctor, cool mama, strict boss.
Yeah, that's great. If not a physiotherapist, what would you be?
I would be nothing but a physio. My work, my de-stress is my off time. Um, and I think I've been doing it for lifetimes as a medicine woman, as a healer, as a physiotherapist. If on second thought, I could be a philanthropist. If not a physio, I could have been just serving the community.
That's great to hear. The next question is, what is one emotion that everybody must get rid of?
Uh, that's about the pain because pain is just a perception. If you don't perceive, it doesn't pain. If you perceive, the pain is 10 out of 10. If you say, no, I'm good, it's like mind over matter. That's what we are going to talk about, the amygdala response and the stress relationship with the back.
Okay, great. And health or wealth?
Health or wealth, it's both actually, but nonetheless, less if you've heard of Ambani say, health has to be earned, it cannot be bought.
Right. Yeah, that's a good one. How do you keep yourself so young and beautiful? I had to ask this question because of our audience.
Looking at you all energetic, my little enthu physio girls and boys, and then it's my work. After a CST session, I feel as if I have taken a session or come out of a spa. And then I do some anti-inflammatory foods, yoga, meditation. I even have therabands in my car.
That's great to do when you're on the way with the traffic. Great, that's good to hear. So we'll come to the topic of the day. What is the mechanism about stress leading to back pain?
So the mechanism is that there are two reasons. One is the stress pain cycle. So I have this poster ready. So you have the stress, can you see it properly? Stress
Yeah.
pain cycle. So when you get stress, you get into muscle tension, daily stress leads to limited activity, non-restorative sleep, fatigue, you get more muscle strength, muscle tense, and then you slowly get into depression and you are in a vicious cycle of pain stress. Second
Mhm.
is your amygdala response. It's when we are in a fight flight reaction. Now, for instant, for survival of the life, it's good. But when it goes into chronic activation, amygdalas are small brain shaped organs a small almond shaped organ in the brain, just above the
Mhm.
midbrain. Now, when you
Yeah.
catch stress, this starts getting active. It's like a thermostat of stress. Now it starts sending signal to the front brain, which is about perceiving pain, and back pain, which is about your emotions and expressions or actions. So if it is hyperactive, it will start sending wrong signals, and that's how
Mhm.
the pain is perceived as too much spasm, too much pain. Sometimes you're quite okay with the pain, but that memory of pain in the nerve cell,
Right.
it puts you back into stress. So that's the mechanism.
So
If you
that's
have
the cycle,
questions,
a
you can
vicious
always
cycle.
read about it. Yeah. So
Yes. Okay.
there's a cascade of release of stress hormones, which is in a very beautiful orchestrated pattern, right from epiphrine to each organ it's supplying. Now, what we as physio and osteopaths, we palpate those organs, which is like from the craniosacral fluid, your heart, lungs, liver, brain, and the fascia around it. We palpate that and we find out. We calm it down, we activate. Okay, we talk about that later. Yeah,
Yeah. No,
sorry.
but that's great to hear. There's some parts of it that we as physios haven't even heard about it. So it's great that we are getting so much knowledge from you regarding this. How do we understand the relations of fascia?
Okay, now fascia, how it is, fascia is covered by a network of parasympathetic and sympathetic nerve supply. And it is connected from the dural lining to your all diaphragms of the body. The pelvic
Mhm.
diaphragm, thoracic outlet, abdominal diaphragm, your tentorium, they are all interlinked as one unit. Suppose you're wearing a one full jumpsuit. Now, if this
Right.
jumpsuit is tight here, and it might lead to tightness in the head and give you a headache, or it is tight
Right.
at the sacrum, it might give you a
Mhm.
back pain. So that's the connection of fascia. Body is a matrix of a network, and a tightness in one part can lead to physiological disturbance in the other part.
Right. Yeah, that totally makes sense. How the relations of connection and connective fluids and connective uh, tissues. So, what are there any fluids for the same that connect some sort of from the brain to the back?
Yeah, that's the craniosacral fluid. And what we
Right.
do is palpation of the craniosacral fluid. We do adjustment of the fascias, and that's how we just bring it into alignment. Yeah.
Okay. Right. So, how do we diagnose this condition if a patient walks in to our clinic with this?
Yeah, that's a very good question. So when the patient walks in, because we are talking about interrelationship between back pain and stress. So first we have a basic valid questionnaire of stress, sleep, appetite. We check their tongue, digestion, and then
Mhm.
we palpate the fascia levels. Where is the tightness? We check the most I'll do is checking the occiput craniosacral rhythm, whether it is moving in flexion and extension. Then we do a detailed musculoskeletal checkup of the
Right.
back alignments, leg length discrepancies, core strength, activation, willingness. In between, we are assessing the client's willingness to improve. Now, most of the stressed and
Mhm.
stressed patients would say, अब तो कुछ हो ही नहीं सकता, अब मैं कब ठीक होऊंगा, and they have like just given up. So all those examinations give us a hint about how to go about. Yeah.
Right. Okay. So once we diagnose somebody with this condition, as a physiotherapist, how can we help?
Okay, so once you have diagnosed that it's a non-specific back pain, there is no unexplained pathology, sorry, of a
Yeah.
locked joint or or all
Correct.
that. So then we would. Sorry, what's your question?
Yeah, that once we know that we've diagnosed this person with back pain, which is related to stress, then how can we help them as a physiotherapist with the treatment?
All right. So we help them with the first is the therapies at the clinic, where we first align their. It's like a chiropractic alignment of the spine. Suppose the sacrum is rotated, the dorsal vertebra is rotated. We would adjust that. Then we will
Hmm.
activate the core, and after that we can do craniosacral therapy sessions. If not, we
For the
are also
stress.
qualified
Hmm.
acupuncturists. We combine with the craniosacral to unwind the fascia, and then we tell
Right.
them some self-help tools of how to manage it at home, and
Mhm.
some breathing. Diaphragmatic breathing is very important. They forget, stress people are mostly in a paradoxical breathing. So paradoxical means that in inhaling, your diaphragm is going up while it should be going down, so you are doing it wrong. So that's like the basic of when a child is born and he has to be doing diaphragm going down, which is like chest breathing. So we correct the breathing, we give him yeah, a lot of regime. It's a holistic program for back pain. Gone are the days of physiotherapy where the patient goes and the therapist just applies एक IFT लगा दिया, ultrasound लगा दिया, हाँ जी हो गया. So many patients come कि मैंने 20 sitting ले लिए, 25 sitting ले लिया, traction ले लिया, diathermy ले लिया. Shortwave diathermy was
Right.
banned in US in 1980. I wonder why people are still using it. I have not had in any of my clinics, never ever in 25 years of my practice. So,
Right.
so we physios have to think out of the box and then
Yeah.
get into new innovative techniques of what is missing now is like the like the patient also knows now. Some of the patients are so aware. The body knows its core. He knows
Yeah.
that it's not a disc slip, but there's something which is nagging and it's not going out of my system. And I visited these 5 physios. I visited the chiropractor there. उसने adjust कर दिया, 2 घंटे में pain आ गया. I did these
Mhm.
sessions there. मैंने 50 ट्रैक्शन ले ली. मैं 2 महीने तक आगे को झुका नहीं. but they also know something is wrong. So we are going
Yes.
into like the third level of that out of the box thinking of what we need to now is help hit the nail on the head and get patient
Yes.
the relief. Yeah. So some of my patients who've been in pain for a good 6 months and have got just 3 sessions, they've got relief. So of course there is a connection in the dural lining, the diaphragms, the pelvic diaphragm, especially postmenopausal, the diaphragm
Yeah.
gets so tight and the
Correct.
lymphatics are all engorged, and that will lead to a
Mhm.
neck headache. No matter you're working for months on the cervical, unless you release lymphatics of the groin, you will not reach results. So it is that kind of an assessment, a treatment plan, and follow-ups. Sorry, my
That's
voice is
great.
back. Hmm.
No, that's totally okay. We were completely able to understand your beautiful voice. But yeah, that definitely makes sense. We approach it in a very conventional manner, and the way you have upgraded us with all this knowledge, I think we have a lot to take home with all of this knowledge. So after we undergo these treatment sessions, as you mentioned, how do we guide our patients with some self-help tools so that we can have like a maintenance home protocol, as we call it, to teach our patients?
Yeah. First is the postural correction, of course. Now, posture correction, they go to a physician who keeps saying posture ठीक कर लो, posture ठीक कर लो. Now, the client doesn't know posture was shoulder पीछे ऐसे करके posture ठीक. This is not only
Mhm.
about posture. Posture is when you are on the screen for 8-10 hours a day. Are your
Mhm.
shoulders back? Is your head on the headrest? You could take a travel
Mhm.
pillow, set it on the headrest, put it against the wall, put your table closest to your waist so you don't have to bend forward. And now this is posture. Sleeping
Correct.
posture, you could have those pillows, but I would recommend is sleep in whatever way you're comfortable. You should just have those orthopedic mattresses. You could have a
Mhm.
small roll under the nape of the neck, which is maintaining the
Yeah.
lordosis. You have a lot of cervical pain. Sometimes we prescribe a figure of 8 for posture. They wear it at home for long hours by the evening when they are tired. Wear it for a couple of hours, get on with your work. 2 hourly
Mhm.
stretching against the wall, doorway stretch, pectorals, this dorsal
Yeah.
extension. And then now,
Mhm.
after the posture, comes to stress handling techniques, which
Mhm.
helps in pain. So there are some activation tools like a vagus nerve activation. You would find a lot of videos on YouTube. Now, vagus nerve is the fight and flight reaction nerve, which we have to calm it down, activate the work of rest, recovery, and digest. So there are points for vagus nerve to activate it, like you have that EFT technique. You tap on this for 2 minutes, you will find, and then just below the umbilicus, the vagus nerve is most superficial, tapping there for about 100 times. That yoga asana of pressing in and Vajrasan mein baith ke flexing down is a very good to activate in vagus point. What we do is
Yeah.
a lot of EMJ release in which all that stress goes off. So we teach some exercises for TMJ also for that after that. And other
Mhm.
things, again, as I mentioned, anti-inflammatory foods, cut down on wheat, increase your barley, millets, a lot of
Right.
antioxidants, fruits, avocados, custard apple, yeah.
Mhm.
Uh, this is so anti-inflammatory diets, and yeah, you
That's
could do
it.
a guided
Yeah.
sleep
So
meditation before you
that's really.
sleep. You could,
Mhm.
yeah, done. Hmm.
Yeah, so that's great to know. Like it's not just what we treat in our clinics, but also what the patient goes home and does at home adds a lot to their recovery.
Yes.
So that was really insightful, ma'am. Yes, ma'am.
Yeah, because 1 hour of session is not covering up for 23 hours of his rest of the time, how he's been
Correct.
handling body and mind. So, a good homework for him to make it like a lifestyle and get on with it and get in more awareness about his body and nerves and how the body reacts and how the nerves can be calmed down and how that chronic amygdala response of always the thermostat being high, which might just the it might just burst one day, is a burnout, which
Mhm.
most of our young millennial generation are suffering from. So this is
Correct.
a need of the hour to work and
Mhm.
with back pain and neck pains. It's like we have to help to handle them, and they are intelligent um, individuals, and if we can guide them. First of all, what I must suggest you as a physio, the physio
Yeah.
itself should be motivated in full enthu and taken charge of himself, his responsibility for feeling happiness, his responsibility to be able to calm down his own nerves. And if the physio knows the
Yeah.
trick, only then you can give it to the patients. So first learn it
Correct.
yourself and then impart it to them. There's just
Yeah.
10% of knowledge we have can do a lot to the patient. So let's get on with it. So it's a message
Yeah.
for all of you. So please read about it. It was all done in first year physiology of hypothalamus and limbic system and all that. It's coming to functioning now with a practical treatment to calm it down. Yeah.
Mhm. Yeah, that's definitely the need of the hour, as you mentioned, ma'am. Other than this, I would love to tell you that all of this knowledge is really helping all our viewers. We have some good comments coming. And thank you so much, ma'am, for being with us here today and giving us a small brief about spine and stress. It's really been very insightful. To come to a conclusion with this live, I would love to ask you one last question, which is in demand right now. How do you keep yourself so young and beautiful?
Oh, you asked me already.
Oh, right. So then we have it again. I think
So,
they missed it. They should rewatch the live. But
yes.
anyway, thank you for being with us here today. I would love to thank you for being a mentor for so many, an inspiration for so many, mine too, for becoming a physiotherapist. It's all because of you. I would
I,
love to thank Dr. Amrish.
I
Yes,
would like
yes,
to
ma'am.
add
Sorry.
2 cents before we close for the session. A little
Yes,
word
for sure.
is what I was
Yes,
just talking
definitely. You
5
can
minutes
go
back
ahead.
is
Yeah.
uh, my quote, what I have been using all my life in all ups and downs, is
Mhm.
reclaim life. So reclaim your health, your mental health, your fitness, your happiness, your physical back, your weak back, your strained back, bothering 30 years. Let's reclaim that. The cells regenerate every 7 years. If you had a back pain
Mhm.
7 years back, it is because of the regeneration or the disc slips, or it is not for life. You will be good after some time if you know how to reclaim it. So
Uh-huh.
that's would end. And also, I would be open to any questions if everyone wants.
Yes, definitely. If there are any questions related to spine and stress or anything related to your physiotherapy related practice, then we are open to questions. So we can hold on for 2 minutes until I thank all the viewers for being here with us today on this busy Sunday afternoon. Thank you for watching us, another episode of PhysioEd. And also like a very big thank you to Dr. Ambarish Akre, sir, my mentor too, for making all of this possible, for giving us this platform to impart knowledge. And yeah, we're open to questions for anybody who would like to ask.
I also use this time to thank you, Dr. Amrish Akre, for giving this platform for people like us who want to be heard. And you are a wonderful, more than professional, you are a wonderful personality too. So it's really good to connect with you again.
Yeah. Okay, so somebody has asked, how many sessions do you require for this treatment to show results?
Depends on how chronic and how receptive the patient is. Sometimes the patient would respond in 2 sessions also. I've had patient who
Mhm.
left for 2 months, and in the first 2 sessions he starts sleeping well. Some people take a couple of months to respond. So it's all individual's threshold and perception of the session.
Right.
Yeah.
Okay, I hope, Prachi, that answered your question. Thank you for asking us this question. I think that's it. We are done with all the questions, which some of them are repeated. So that's all for today. I'm so happy to have been a part of this amazing life. And again, thank you so much, ma'am, for joining here with
Thank
us
you,
at
Bhavin.
this live on your busy schedule. We have taken some of your time.
No,
Thank
I'm
you,
busy.
viewers, once again.
Yeah, I said
Yes.
it's a Sunday, no worries. I'm always
Okay,
there. So
that
please post your questions and I would love to answer later also.
Yes, yes, we can have some more questions on the chat box after this video is posted, and ma'am would reply to us regarding that. And probably you can schedule another session with ma'am if there are more questions to address. So thank you again, and signing off, PhysioEd. Thank you for joining us with this episode.
Yeah. Okay. Bye bye. Cheers.
Okay, bye
God
bye. Yeah,
bless. Bye bye.
thank you. Bye bye.